House Amendment Schedule A, LCO number 8543, offered by Representative Biggins, Representative McCarthy-Vahey, Senator Anwar, Senator Summers.
The representative seeks leave of the chairman to summarize the amendments. Is there any objection? Seeing none, Representative Biggins, you have the floor.
Thank you, Mr. Speaker. So this amendment is a strike-all amendment where students who are inpatient in the hospital for 12 or more days and receive a safety plan or a list of coping strategies and other things that might help keep them safe. The practitioner will need to ask the patient or the parent of the patient if they're 16 or 17 years old, if they should share the safety plan with the child's school. And then the other part of the bill is we created a way for them to share the information with the school so that it's free for schools and it's a secure transmitting for HIPAA compliance or medical providers to be able to communicate with the school entities. Thank you, Mr. Speaker. I move adoption.
Mr. Speaker, I rise in strong support of the bill before us today, and I rise also to thank the good representative, member of the Public Health Committee, who has led the debate today on the bill, as well as our ranking member. I'd also like to thank the Connecticut Hospital Association and the State Department of Education for their collaborative effort on this bill. Why is this bill so important? Mr. Speaker, this bill is so important because we've seen a rise in youth suicide in our nation. We've seen a rise in youth suicidal ideation. And this bill makes it easier for those who serve, support, and work with our young people, our students, to help keep them safe when they are at school. This bill is a support to those teachers, to those nurses, those providers. This bill is also a support to parents who, it may not be about not being able to do the right thing, it may be about the fact that their family is in the midst of a crisis. And this is one step that can be taken to help that family as they are in the midst of the crisis. So again, I think this bill is a tremendous example of collaborative efforts where the good representative really reached out to so many stakeholders. And I hope that this chamber can continue this conversation going forward to expand our ability to do so. I know that the good representative will be continuing these conversations going forward, and I again urge all members to join me in supporting this bill. Thank you, Mr. Speaker.
Would the clerk please announce the tally?
House Bill 7158 is amended by House A. Total voting 147. Necessary for passage 74. Those voting A 105, those voting A 42. Absent not voting for.
Bill as amended passes.